Analyzing medical diagnostic and lab reports could be very confusing for anyone, including doctors. But what if ChatGPT could read and help you understand all of them very easily and in just a matter of few seconds? In today's demo, I will show you how to use ChatGPT and how it can help doctors and patients, both of them, make sense of complex reports. Before we get into the demo, I want you to watch my earlier video so that you know where we started and in this part of the series, how AI transforms Medicare. Let's go. In our previous video, we did a demo where a panel of specialist doctors they gave their inputs, right? They gave recommendations for their each area of specialization, like endocrinologist, neurologist, environmental toxologist. So same way all of them were given, and then there was a battery of tests that was prescribed to the patient. Now, let's assuming that all the tests were completed by the patient. Okay, what can we do? So I have attached all the diagnostic tests of the patients here, and as a patient, I'm writing a prompt here. Doctors can also do the same. I'm attaching the recent lab test and diagnostic reports. Can you explain what these markers indicate in simple language that I can understand it? Also, do they suggest any inflammation and autoimmune issues? Or what condition should I discuss with my doctor? Please explain in simple terms. Okay, let's try. So this is the response from ChatGPT. It says, thank you for providing the reports. As you have requested, I have reviewed everything, and this is for 37-year-old woman named Maya. She had symptoms of fatigue, joint stiffness, most probable muscle loss, autoimmune concerns, right? This was all what we discussed in the last demo. So this is a summary. Main goals for interpretation: check for inflammation and autoimmune disease, understand vitamin or hormone imbalances, evaluate muscle joint relatable issues, identify environmental and metabolic concerns. So key finding by category. We have attached so many reports, right? So it says this was negative, no signs of lupus or connective tissue disease based on these markers, so which is good. Then this was also negative. Rheumatoid factor is also negative, right? So this is good for that patient. Conclusion: these results do not suggest any autoimmune disease like RA or lupus right now. This reassuring gives you joint symptoms. Next is inflammation and liver markers. CPR and ESR not available. Liver enzymes are all normal. Albumin is also normal. So conclusion again, it has given no active inflammation detected. Thyroid high suggest subclinical or early hypothyroidism. So this is one which has been found out. Conclusion: you may have an underactive thyroid, which can cause fatigue, mood, hair issues, hair thinning issues, joint stiffness. You should discuss this with an endocrinologist. So good conclusion it has come. Vitamin and nutrition. Vitamin B12 is low, can cause fatigue, nerve issues, and cognitive problem. Then vitamin D12, D is not tested. Triglycerides are elevated. So conclusion is B12 could cause brain fog and fatigue. We discussed this all the symptoms in our previous video. Then it also asks for check vitamin D. Bone and muscle health. DEXA scan was done. Everything was normal except for forearm, which was borderline. That means lean mass muscle. Some reduction may suggest muscle loss. So again, there are general blood tests, ultrasound, abdomen test was done. What now? It is giving a summary. What Maya should discuss with her doctor. Likely diagnosis or concerns to discuss. Subclinical hypothyroidism may explain some of the symptoms. Vitamin B12 deficiency that needs correction. Potential or possible B12 vitamin D deficiency. This needs to be tested. Then there is mild fatty liver. What can you ask your doctor? How should you start low dose thyroid medication? Where can I get vitamin D? In fact, these answers can be given by ChatGPT themselves. We will discuss that in our subsequent things. But it's always good to have a validation by the doctor. ChatGPT, let's not assume that ChatGPT is accurate. Doctors are more mature and educated, but ChatGPT could be an supplemental information. Next steps for Maya. So neatly it is telling. See, when you go to a doctor, most of the times doctors don't have time. They're running from patients to patient surgery and so many other things, right? They may not be able to give you such detailed time to tell you what are your next steps. But here it is giving in a very cool, calm, and sensible fashion, saying that start B12 supplements, discuss thyroid treatments, ask for vitamin D tests, modify your diets, low carb, sugars, anti-inflammatory foods. Start low impact strength exercise for joints. Use air purifiers if environmental exposure is high. So nice. Say, assuming you are a patient and you're not satisfied with this, you want to go a little one step more. You can try one more chat. I'm just suggesting you try as many chats as you want with ChatGPT or Perplexity. Here I'm saying, based on these labs and symptoms, is this more likely like autoimmune arthritis? It has already given the answer, but we are trying to go a little more detailed and about precision right here. Let's see what's the response. It says, based on the lab report, symptoms for Maya, autoimmune arthritis like rheumatoid arthritis or lupus is not strongly supported at this time, which is very good for her. So it says that there is this profiles summary of why autoimmune arthritis is unlikely at this stage. So it is giving each one of them. ANA profile negative. As a just question yourself, right? As a normal common person who is not into medical field, do we even know what these are? But ChatGPT knows, and it is also telling it is negative, and it is interpreting that for you, like rules out SLE. If you want what SLE is, ask for it. You ask whatever is wherever you're stuck. Let's see this one. Say you ask this. Help me understand this in a simple language like a 10-year-old. So I will take this test because I don't understand this, and I will just put this here, and we will wait for the response. Okay. Meanwhile, let's go ahead. So it has given other information about um, rheumatoid factor. There are other blood tests, symptoms that overlap, morning stiffness, fatigue, brain fog, so and so, right? These symptoms do raise suspicion for early autoimmune involvement at the clinical level, but without lab confirmation, it may currently fall into one of the following, which is undifferentiated connective tissue disease, or thyroid autoimmunity, or phlebogasemia, or vitamin B12 deficiency, things like that. So, final thought: your current lab report do not suggest a diagnosis of autoimmune arthritis or rheumatoid arthritis. So, again, what's the plan? Treat the thyroid, correct B12 efficiency. And let's start with this one. We wanted to understand the ANA profile as a very simple. Let's try that. So it's giving the response now. It says, sure, is a very simple explanation, like how I can explain to a 10-year-old. ANA test is the body fighting itself. That is why it is called ANA. ANA test checks Maya's immune system is attacking her own body by mistake, like a superhero fighting for the wrong people. Now Maya's result is negative. That means her immune system is not doing that right now, which is very, very good. Let's try one last prompt for this about B12. Okay, I'm just asking B12 and thyroid level suggest a risk for nerve damage. Let's try this out. Now, whatever your questions could be, whatever your clarifications are, keep experimenting with ChatGPT. Keep asking it. Keep pushing the boundaries of ChatGPT. Ask it to play the role of a doctor. You will see miraculous, responses coming for it. All right. Here the question was about connecting nerve damage neuropathy with B12. Yes, Maya's B12 and thyroid levels do suggest a risk for nerve damage, especially if untreated. B12 B12 is like food for your nerves and brains. When it is too low, the nerve starts misfiring. Oh, wow. I never knew that. Which could cause tingling or numbness in hands and feet, muscle weakness, poor memory or focus, even balance problems or burning sensation. Maya's B12 is below normal, which puts her at risk. It is what it is saying. Thyroid also, this means thyroid is underactive. When thyroid is low, the nerves slow down like sluggish Wi-Fi. Oh my God, so simple. When thyroid is low, I'll repeat this. When thyroid is low, the nerves slow down like a sluggish Wi-Fi. It can cause tingling, numbness, joint pain, muscle aches, slow reflexes, cold hands, feet. Combined with B12, the increase of risk of developing nerve problem, especially not treated soon. Bottom line, yes, Maya is at risk for neuropathy, nerve damage due to B12 or underactive thyroid. What to do? Start B12 supplements or injections. Discuss starting taking low dose of thyroid medicine. Consider testing vitamin D, iron, and other medicines that are required. How beautiful is it?
Subscribe to Career Story 60 and unlock your Chat GPT superpowers.